Unfortunately, cancer is not a single disease, but rather a group of diseases characterized by the uncontrolled growth and spread of abnormal cells. There are many different types of cancer, each with its own set of unique characteristics. And as such, there is no one definitive cure for all types of cancer. Instead, cancer treatment typically involves a combination of different approaches, including surgery, radiation therapy, chemotherapy, targeted therapy, immunotherapy, and other supportive therapies, such as pain management and palliative care. The specific treatment approach used will depend on a variety of factors, including the type and stage of cancer, the patient's overall health and medical history, and other individual factors. Surgery. Surgery is a procedure in which the cancerous tumor is removed from the body. It is often the first line of treatment for solid tumors. In some cases, surgery may be combined with other treatments such as radiation therapy or chemotherapy. Radiation therapy. Radiation therapy uses high-energy X-rays or other types of radiation to kill cancer cells. This therapy can be delivered externally or internally. External radiation is delivered using a machine, while internal radiation is delivered through radioactive seeds, wires or other implants. Chemotherapy. Chemotherapy uses drugs to kill cancer cells. The drugs can be administered intravenously or taken orally. Chemotherapy is often used when cancer has spread to other parts of the body or if the tumor cannot be removed surgically. Targeted therapy. Targeted therapy is a treatment that targets specific molecules that are involved in the growth and spread of cancer cells. This type of therapy is often used for cancers that have specific mutations or genetic abnormalities. Immunotherapy. Immunotherapy is a type of treatment that uses the body's own immune system to fight cancer. It works by stimulating the immune system to recognize and attack cancer cells. Supportive therapies. Supportive therapies include pain management and palliative care. Pain management aims to relieve pain caused by cancer or its treatment. Palliative care is focused on improving the quality of life for people with cancer by managing symptoms such as pain, fatigue, and anxiety. In many cases, cancer treatment involves a combination of these therapies. The choice of treatment depends on the type and stage of cancer, as well as the patient's overall health and preferences. It's important to work closely with a team of doctors and healthcare professionals to determine the best course of treatment. Despite the progress that has been made in cancer treatment, there is still much that is not fully understood about the disease. Researchers continue to explore new treatments and therapies, and clinical trials are ongoing to test new approaches and refine existing treatments.
One promising area of research is precision medicine, which aims to tailor cancer treatment to the unique characteristics of an individual's cancer cells. This can involve analyzing the genetic makeup of the cancer cells to identify specific mutations or other factors that may be driving the growth of the tumor, and developing targeted therapies that can effectively target these specific factors. Another area of research is the development of new immunotherapies that can overcome the challenges of the tumor microenvironment, such as immune suppression and resistance to treatment. Overall, while there is no single definitive cure for cancer, significant progress has been made in understanding and treating the disease. As research continues, it is likely that new and more effective treatments will be developed, bringing us closer to a world without cancer. Holistic therapies for cancer refer to a wide range of complementary and alternative therapies that are used alongside conventional medical treatments. While there is no scientific evidence to support their effectiveness in curing cancer, many people find these therapies helpful in managing symptoms, reducing stress, and improving overall quality of life. Here are some examples of holistic therapies for cancer. Acupuncture. Acupuncture is a technique that involves inserting thin needles into specific points on the body. It is believed to stimulate the body's natural healing processes and reduce pain and other symptoms associated with cancer and its treatment. Massage therapy. Massage therapy can help relieve pain, anxiety, and fatigue. It may also improve circulation and lymphatic drainage, which can help reduce swelling and inflammation. Meditation and mindfulness. Meditation and mindfulness practices can help reduce stress and anxiety and improve overall well-being. Yoga. Yoga combines physical postures, breathing techniques, and meditation to improve strength, flexibility, and relaxation. It may also help reduce stress and anxiety. Herbal remedies, some herbs and supplements are believed to have anti-cancer properties or may help reduce side effects of cancer treatment. However, it's important to speak with a healthcare professional before taking any herbal remedies or supplements, as some may interact with other medications or have harmful side effects. It's important to note that holistic therapies should not be used as a substitute for conventional medical treatments for cancer. They should be used in conjunction with medical treatment and under the guidance of a healthcare professional.
While a healthy diet can help reduce the risk of developing certain types of cancer, there is no single diet that is proven to be effective against cancer. However, research suggests that following a diet rich in plant-based foods, lean protein sources, and low in processed and red meat may be beneficial in reducing the risk of cancer. Here are some dietary guidelines that may help reduce the risk of cancer. Eat a variety of colorful fruits and vegetables. Aim for at least 5 servings of fruits and vegetables per day, including leafy greens, berries, and citrus fruits. These foods are rich in vitamins, minerals, and antioxidants that can help protect your cells from damage that can lead to cancer. Choose whole grains. Whole grains, such as brown rice, quinoa, and whole wheat bread, are a good source of fiber and can help reduce the risk of colorectal cancer. Limit processed and red meat. Processed meat, such as hot dogs and bacon, are linked to an increased risk of colorectal cancer. Red meat, such as beef and pork, may also increase the risk of colorectal and prostate cancer. Try to limit your intake of these foods and choose lean protein sources, such as poultry, fish, and plant-based proteins like lentils and beans. Limit alcohol consumption. Excessive alcohol consumption is linked to an increased risk of several types of cancer, including breast, liver, and colorectal cancer. Limit your alcohol intake to 1 drink per day for women and 2 drinks per day for men. Avoid sugary drinks. Consuming sugary drinks, such as soda and energy drinks, may increase the risk of certain types of cancer, such as pancreatic cancer. Instead, choose water, unsweetened tea, or coffee. It is important to remember that no single food or diet can prevent cancer, but maintaining a healthy and balanced diet, along with regular exercise, can help reduce your risk of developing certain types of cancer. It is also important to talk to your healthcare provider about cancer screening and any concerns you may have about your cancer risk. There is no scientific evidence to suggest that spirituality can directly cure cancer. However, many cancer patients find that spirituality can provide them with emotional and psychological support during their cancer journey. Spirituality is a broad concept that encompasses a sense of meaning, purpose, and connection to something larger than oneself. For many people, spirituality is expressed through religious practices, such as prayer, meditation, or attending religious services. For others, spirituality is expressed through nature, art, or music. Studies have suggested that spiritual practices can help cancer patients cope with the stress and anxiety that often accompanies a cancer diagnosis. These practices can also help patients find meaning and purpose in their lives, which can contribute to an overall sense of well-being. It is important to note, however, that spirituality should not be used as a substitute for standard cancer treatments. Cancer treatment should be guided by evidence-based medicine, and patients should work closely with their healthcare providers to develop a treatment plan that meets their individual needs. Spiritual practices can be used in conjunction with medical treatments to help support a patient's emotional and psychological well-being during their cancer journey.